Reverend Katey Zeh, thank you for being with me today in Compassion School. RCRC is doing this school not only focusing on reproductive freedom, but with an understanding that without compassion, we really cannot have full justice in our society and world. And so today we want to dive into a very critical topic that's impacting all of us in some new ways, and that is the issue of racism in the US and how it impacts reproductive freedom and beyond. So following the murder of George Floyd, Dr. Michelle Williams, Dean of Harvard University School of Public Health, said racism is a public health crisis. She continued, that reality is apparent not just in police brutality that disproportionately claims the lives of Black Americans, but in the legacy of slavery and discrimination that persists in countless social determinants of health. Dr. Williams continued, one need only examine the disparities in healthcare, pollution exposure, and access to green spaces, nutritious food, and educational opportunities that have long harmed health and prematurely ended lives in marginalized communities. That's the end of her quote. And then there was also Dr. David Rossman, who is the president of the Massachusetts Medical Society, who said this: systemic racism in and of itself causes illness and premature death for people of color. End quote. In our work in RCRC, we are looking not only at the issues of abortion and contraception, but also the reality of pregnancy-related mortality rates in this country that are higher than any other of the developed nations in the world. 700 women die every year as a result of pregnancy or its complications. And I note that's in the midst of this other focus, a hyper focus on contraception and abortion. There are women who are dying because of pregnancy-related mortality in a developed nation. Katey, I'm just pissed about that.
Yeah, and how much money we spend on healthcare.
And then add to that dimension the implications or the impact of racism in America. American Indian women and Black women are 3 times as likely to die from pregnancy-related causes than white women. And for Black women with at least a college degree, it goes up to 5 times more likely to die. So if compassion were a guide for approaches and policies about reproductive health care, what impact do you believe that could have in lowering pregnancy-related deaths for all women, and especially for Indigenous women and Black women here in America?
Well, this specific issue of maternal mortality or pregnancy-related death is one that I've been involved in for quite some time. I used to work on this as a global issue during the time of the Millennium Development Goals set by the United Nations, where I think the aim was to reduce preventable maternal mortality by 50%. I can't remember what the goal was, but that was the framework that I was working in at the time. And there are a lot of parallels to what's going on in the United States. And in fact, during that time, the US was one of the few countries overall where maternal mortality was going up and everywhere else it was going down. And I remember thinking, that is so messed up. How is it that this is this is a global focus? Why are we failing people in this country so badly? And then knowing the disparities racially is just beyond maddening to me. So when we look at what globally has happened and why other countries have been so successful in lowering their maternal mortality rates, it's because they've invested in community health workers. So folks who are from the communities they serve, who speak the language, who understand the culture, who are trusted providers, and oftentimes know better than the political leaders exactly what's happening on the ground. And a lot of times those healthcare providers are not professionalized in a Western sense, right? They're folks who have learned how to keep women and other people giving birth safe through knowledge that's been passed down from generation to generation. Yes. And so when I think about, and in the United States at the time that I was realizing that the rates were going up, I remember trying to figure out why, even though it wasn't the focus of my professional work. I said, there's got to be some data out there about why this is happening. Mm-hmm. And there was nothing. Everything that I could find at the time, I'm talking about 10 years ago, everything that I could find about why Black women in particular were dying in childbirth was so racist. It was so much steeped in this whole idea of personal responsibility with no regard for the social determinants of health at all. And I just remember thinking, this cannot be true. Why do we not have the data on this? Why are we not researching this? Why are we not putting resources behind this? And at the time, I don't know if this is true now, but not every state had a board that would review maternal deaths in their state. And so there was nobody who was following up to understand why this was happening. It was in the majority of the states. I don't remember the exact number. And so I just remember thinking, we do not care about this, or
do not care. Yeah.
Putting resources behind it. And I would say since that time, Black reproductive justice advocates in particular have been pushing for understanding this, for calling politicians out for the hypocrisy of calling themselves pro-life but not caring about Black women dying in childbirth. And I think there's probably better data on it now than there was 10 years ago. But when I think about what it would look like practically, I think about those community health workers, and I think about investing in Black and Indigenous midwives to serve their communities, because they're going to provide high quality care and they're going to be more trusted than folks who don't look like the people that they're serving. And we know from studies that women in general, but Black women in particular, are not believed when they express their symptoms to healthcare providers. They're just ignored or they're misdiagnosed. And so I think having providers from the communities will be essential in lowering not just maternal mortality rates, but just improving well-being overall, because being able to birth with dignity is a huge reproductive freedom issue as well, and is really essential for people's overall well-being. And so I think investing in community health workers from the communities that are most impacted would be an essential part of having compassionate policies and programs around maternal health.
You know, when you said that Black and Indigenous women often have not been believed when they've said, you know, here are the symptoms I'm having, this is what I'm feeling. You know, it is very much comparable to me when there's a Black man down on the ground saying, I can't breathe.
Yeah.
And people are not believed.
Right.
And not valued for their experience. And we know that even Black women who are in the higher income brackets, often when they have said to medical doctors, here's what I'm experiencing, they're also not believed.
Serena Williams.
Yes.
Is that what you're about to say?
Yes.
Oh my goodness, she had to basically orchestrate her own care to save her own life. And even then, she still wasn't believed. The best athlete in the world, was still not believed. And I imagine she probably knows her body better than any of us do.
Yes, yes. And there's so much aligned with women not being believed.
Mm-hmm.
So women who are survivors of sexual assault not being believed when they talk about what they've experienced. Then add color to that. And we know that from the research, and you were talking about studies from 10 years ago when you were doing the global health work, research for medications for years and other medical treatments, the research focused on white men and what worked for their bodies.
Mm-hmm.
Only in the last 20 years, somebody woke up and said, oh, maybe we ought to look at the differences with women's bodies. And I believe that's because more women became researchers and kept pushing for that. And so now there is also, because the who's doing the research are often not women of color, then their voices don't get heard and the realities of their bodies are not being factored in. And
Mm-hmm.
as Dr. Michelle Williams, Harvard University Dean of the School of Public Health, said, racism is a public health crisis.
Mm-hmm.
You talked about those who identify as pro-life and who have been going along without any regard for the reality of the skyrocketing rates of maternal mortality here in the US. How is it that someone who identifies as pro-life cannot be looking at that issue? Do you have some insight about that?
Oh gosh, these labels are so problematic and don't fit most people, and the obvious contradictions within that. I mean, we could talk about that all day. And I think as a political ploy, it's about winning political points and not about actually caring for people in their communities. Because it doesn't center the real life people who are navigating tough reproductive decisions. So compassion is not at the center of that. And if we were to take a more compassionate approach to these kinds of conversations, the people who are most impacted would be at the center. So who would be driving research? Who would be driving innovation? Who would be funding it? All of those would be different. It would be different in a compassion focused pro-life agenda, political agenda. And frankly, we would just have fewer white men being the loudest voices on this issue. I'm just so tired of it. They are not the ones most impacted, to make it plain and clear.
So when there's not compassion woven into the fabric of research, the fabric of healthcare policies, et cetera, then the kinds of approaches that there are to contraception, to abortion, to intrafertile, I always say IVF, and so then I get lost.
Yeah, in vitro.
In vitro fertilization and maternal mortality. It's all one thread, really.
Mm-hmm.
A thread that is greatly absent the interweaving of compassion, because then it all comes the same thing. We don't value women and trust what they say they need for their lives.
Right. Right. Yeah. And the issues get painted in these very broad strokes.
So how do we help turn that around, and our audiences? How can people, and especially people of faith, help push the importance, promote the importance of weaving compassion into all reproductive health care, all aspects of reproductive health care? What can folks do?
I mean, we said it before that compassion is about, as you said, I think last week, celebrating our humanity and honoring our humanity. And there's a shared experience, but there's also our very individual experiences that are informed by circumstances that are different from person to person. And so when I think about compassion being at the center of a conversation about reproductive freedom, reproductive decision making, reproductive loss, it's about making room for all of the different stories and circumstances and experiences that are out there. I've yet to talk to two people who've had the same reproductive journey. It's all so unique. And everyone, there's no better person to make a decision or to name what the experience was than the person who experienced it personally. And I think by creating space with compassion, we can actually listen and hear what that unique experience was and see that we're not in a position to have made that decision for anyone else. But I think it's also important to respect the fact that no one should have to disclose their most vulnerable or difficult or personal story in order to be treated with dignity and have access to compassionate, affordable healthcare. You know, I think sometimes we keep trying to shift the narrative by asking people to be very public about what they've been through. And if we can make compassion the value, that would no longer be required. If people want to share their stories, that's wonderful, and we should be able to create space for it, but it shouldn't be the deciding factor on whether or not we have policies that are compassionate.
So I'm thinking, and I'm horrible with remembering names, but I'm thinking about the US Senator who recently spoke about the abortion story in his family. That is a story that was completely devoid of compassion.
Yeah.
For someone to be sent home and told, sorry, there's nothing we can do for you.
Right.
Because of the policies of this hospital.
Right.
Because of the religiously framed policies of this hospital. And I'm stating it that way because that's not religious. Something that lacks compassion is not religious. It can be religiously framed.
Right.
But it is not religious. Because at the core of religion is compassion.
Right.
And I'm so glad that he shared that story. I know it was painful to relive it, but it was important that it came out in the conversation and in the news as we're looking at the confirmation hearings for Judge Amy Coney Barrett. We need more people to talk about their stories, and we're grateful for our sister organizations that are telling abortion stories, that are telling the stories where people were not allowed to get abortions because of some religiously framed protocols that are not about medical care, and they're completely not about the patient.
Right. Right. And I've just been researching very recently what happens when someone is denied an abortion. Because one of the central premises of the anti-abortion movement is that terminating a pregnancy is psychologically damaging to the person. But it's not. It's not being able to get an abortion when you need it. That's what's psychologically damaging to people. That is what actually results in mental disorders. It is not obtaining one, it's being denied.
And I want to say this, also impacting people, is the shaming about abortion. the shaming about contraception, the shaming about infertility.
Right.
It is the shaming in this culture that causes so much emotional damage to people. There is no compassion in it, and it does not improve the quality of who we are as a society.
Absolutely.
I'm pissed.
I
I'm
know.
pissed.
Yeah. I mean, it seeps in. It seeps in. It's so insidious, the shame that you're talking about, that even if it's never directly said to a person, it's in the ether. It is.
Yes.
It is experienced by all of us. It is an energy that impacts all of us, regardless of what we're taught. And it stands in the way of people getting the kind of care that they need. And not just reproductive care, all kinds of care has shame connected to it. If our bodies aren't functioning in a certain way,
Yes.
then we're
And
feel bad
if
about it.
those bodies are bodies of color
Mm-hmm.
that also experience shaming,
Right.
then when that is added with the shaming of women, the shaming of reproduction, you know, sex and reproduction, the shaming of Black and brown bodies, we really have to make some significant change. This is such a critical time for us to do that now, because if we believe in the quality of life, that really needs to be guided by compassion for people who are walking, talking, living, breathing, decision making, working, raising children, on and on and on, right here, right now.
Yes. And I don't know if this has been said, but abortion is a form of self-compassion.
Amen. And we really want for more people to understand that.
Mm-hmm.
That is a principal belief of RCRC and our family of supporters. Abortion is a form of self-compassion, and we support those who are providing that sacred work, that care, and those who make that decision. Bless you, and especially those who are women of color who are making that decision against so many odds and oppositions and shaming, etc. And we love you all out there, and thank you so much for being with us this week. This is a biggie, and Katey, as you said at the beginning of our time, we could talk about this all day. But I hope what we've shared in these 20 minutes or so at least gets folks thinking about these issues some more. And please share with folks in your life. Share this video, share the conversations, the thoughts that come to you, because we've got to transform it. And especially share abortion is a form of self-compassion. That tweet that today. Thank you all so much. Thank you, Katey.
Thank you, Cari.